So that again changed my whole world because now I was a parent of a disabled child, and it really, although it was a tragedy, it really helped me become a better therapist overall because now I had the point of view of not only a speech language pathologist, but also a parent of a special needs child. And I think I would love for parents to know that it's not a reflection of your parenting if you need help. So it's never too early to ask for help. It's never criticism about your parenting if your child is a late talker.
Welcome to the Wheel With It podcast with your host, Devon. Let's get into the episode.
Hello. Welcome to another episode of Wheel With It. My name is Devon Wieters, and today on the show we have Jeaneen Tang, a delight to talk to, and I think you're really going to love this conversation. I know I learned a lot, and I think you will too, so please enjoy my conversation with Jeaneen Tang. Hello. Welcome to another episode of Wheel With It. My name is Devon Wieters, and today we have Jeaneen Tang on the podcast with us. How are you today, Jeaneen?
I'm doing great, Devon. How are you?
I hope I pronounced your name right.
Exactly. You did it exactly correct.
Yay. Tell us about yourself, and then we'll go from there.
Great. So I am a speech language pathologist. I've been one for 23 years. I'm originally from Honolulu, Hawaii, and I moved to Los Angeles in 2005 thinking I was going to be an actor. But thank goodness I was already a speech therapist because waitressing part-time and trying to do acting is much harder than working part-time as a speech therapist and trying to do acting. That was great that I did speech therapy. And when I had my son in 2012, it really changed my approach to speech therapy because I was now a parent. And when my son was 13 months old, unfortunately, he had a fall and had a brain injury. And a few days later, he had a stroke. So that again changed my whole world because now I was a parent of a disabled child, and it really, although it was a tragedy, it really helped me become a better therapist overall because now I had the point of view of not only a speech language pathologist, but also a parent of a special needs child. And I could see both sides, right, as a parent as well as a therapist. And I approached therapy differently, how I approached working with families differently. And, it created a greater empathy for the families as well as the children.
Why did you want to become a speech therapist?
Yeah, I wasn't really sure exactly what I wanted to be when I was growing up. I thought I wanted to be a teacher. I think when I was 8 years old, my grandfather was ill and he ended up passing away from lung cancer. And I remember at the time feeling very helpless, like I wanted to be able to help him more. But being only 8 years old, you can only do so much, right? It really sparked this fire in me to want to help and be caring for people. So I thought maybe I want to be a teacher. In high school, I played sports, and I thought maybe I want to be a physical therapist. So I went to school at college and knew I needed to have a graduate degree to be a physical therapist. So I got my bachelor's degree in English literature with a minor in creative writing. And I was going to apply to physical therapy school, and I felt like everybody was doing that at that time. And physical therapy is a very saturated environment. Someone mentioned speech therapy, and I really hadn't heard too much about it growing up because I didn't need speech therapy. None of my friends that I knew of needed speech therapy, but I had done some performance speech in high school and college, and I thought that maybe it would fall into the realm that I would be familiar with. And looking back, my elementary school did have a special education classroom. And looking back, those children probably needed speech therapy. And I went to school at the University of Hawaii at Manoa for my graduate program where I was from. And I was able to complete the program. I did 1 year of prerequisites and then 2 years of the graduate program. And I was able to get a stipend if I worked for the Department of Education for 3 years. So it's kind of like a guaranteed job in a way. And I'm really glad that I went that route because I love speech therapy. I've been doing it for over 23 years now, like I said, and I've worked with all different ages. I've worked with preschool all the way through geriatric adults. Currently, I still work twice a week in the hospitals with adults, and the rest of my time I spend mainly with early intervention, which is 0 to 3 years old, as well as a handful of school-age children. And I love it. It's a great field. I meet so many different kids and adults and families, and it's a really great and rewarding career.
So are you in private practice or are you in the schools?
So I did schools for 4 years in Hawaii and then schools here in Los Angeles for 4 years. So right now I have a handful of private clients. For the hospital job, I work with one company part-time. And then for the early intervention, I work with a different company part-time. So I do a little bit of part-time work with an employer, and then I have some private clients as well.
My interesting fact, my best friend is a speech therapist, and I literally watched her go through grad school, all that, because we've been friends for 20 years, and she loves speech. But so it's been very interesting to see the interventions that she does with people. It's been very interesting.
Does she like to work with one population, like adults or children?
She works with children. She loves kids, so she works with children.
Yeah, I couldn't really pick one population. I love working with both adults and children. So I chose to work part-time in both.
Yeah. What's the difference for those who don't know between adult speech and children's speech?
That's a great question. Thank you. So for adults, a lot of times I actually do a lot of swallowing disorders. So a lot of patients come in and they might have altered mentation, they might be confused, or they might have had a stroke, or some people have a drug overdose sometimes, or they might have a progressive degenerative disease like Parkinson's or multiple sclerosis, which affects their swallowing as well as sometimes their cognition. We also deal with patients with respiratory failure that have had tracheostomies put in, right? So they are able to speak if they have a speaking valve, right? This is the valve that is a one-way valve. Air goes into the valve, but it forces the air up towards the vocal cords, and then they can speak. And then sometimes we work with patients on cognitive things such as after a stroke, if they're not able to speak or express themselves or understand. And we work with articulation as well. And then for the kids, it's all developmental mainly, right? So most of the time they have a language delay or a speech delay. Sometimes we work with children on the autism spectrum disorder on just how to communicate. We work with children who may have had either Down syndrome or cerebral palsy on working on articulation and language, socialization. And then in my son's case, he was born, as far as we know, very normal, and he had an accident. So he acquired his disability. And in that case, it's a lot of rehabilitation, and also because he was so young, it was a lot of developmental things he needed to learn as well.
You wrote a book, and what is that about?
So I wrote a book called Play, Dumb and Sabotage, and the subtitle of it is Mindfully Under Anticipating the Child's Needs and Creating Opportunities to Practice Language. And Play, Dumb and Sabotage is a term I've used for many years. And kids love to be smarter than adults, right? So I'll ask a lot of absurd questions. Like I'll say, does a dog say ba ba? And usually kids will kind of look at me like, what? They'll give me a questioning look like, that's not what a dog says. And it builds rapport, right? But in the greater sense of play, dumb, and sabotage in language development overall, I find that working with children in the early intervention realm, which is 0 to 3 years old, a lot of kids that need speech therapy are often late talkers. And because I feel that their parents are trying to be really great parents and over anticipating the child's needs. So they'll know exactly what the child wants to eat or drink or play with, what they wear, what they want to wear, or play anything that the child might want. They over anticipate the child's needs. So the child doesn't really have to naturally express themselves or communicate and interact with their environment. So a lot of times parents are wondering why their kids are not talking at that 1 years old, right? You want to say your first word at 1 year old, and then have 2 words and 3 words at 2 years old and then 3 years old. And so a lot of these kids are coming to speech therapy as late talkers. They're not having many words at all at age 2. And the parents are wondering why. So it's a lot of knowing what the child needs, but then mindfully under anticipating, like purposely not doing for the child, but letting that child learn to express and do things like at snack time. A simple way to play dumb and sabotage is if they have goldfish, right? They like goldfish crackers, give them a couple goldfish and have the bowl nearby but out of reach. So the child needs to indicate either through a sign or through verbal or vocalization that they want more. And the sabotage part of it is creating that practice. So giving the child a couple goldfish every time they're able to indicate that they want more or communicate in some way, whether it's through pictures or signs or through words and sounds.
Why do you think so many kids need speech therapy nowadays?
Yeah, it goes back to those parents, right, who are really good caregivers and they want to show and they want to be able to know what the child might need or want, right? And as a new parent, I knew exactly what my child might want to play with or might want to eat just by the vocalization that a grunt, we know what they want. So we tend to over anticipate and cater to the child's needs too much. And then the child learns to be waited on in a sense, right? So they don't necessarily have to communicate because everything is provided for them. And a lot of these kids who are late talkers are really just cognitively sound. They understand everything. Physically, they can run around, they can climb on their furniture, they can walk upstairs a lot of times. So physically they're sound, cognitively they appear sound. It's just expressively they are not able to communicate because they're not practicing communication. And so a lot of times you'll see these kids have behaviors because they're used to having everything provided for them. And if they start to cry, the parents, might give them a snack because that's how they pacify the child's crying. They don't want the child to cry. And one of my chapters is no child's ever died of crying as far as we know, right? So I would say it's okay if a child is able to do something, right? I had a child the other day. She is able to imitate 1 word, 2 words, 3 words even with a close approximation of sound. It might not be perfect, but she can try it. I know she can do it. And she did not even want to imitate a single word. She just wanted whatever the toy was. She wanted it and she was trying to reach for it. She was going to whine or cry because she wasn't getting it. But I knew that there was a ability. She had the ability to do the task. She just didn't want to do it. And oftentimes at home, if she would cry or whine a little bit, the parent would just give in and say, here you go, here's a cake pop, or here is a whatever you want to eat or play with. And it's like training these parents to know that your child is able to do something and you need to be a little bit more stubborn than they are and stretch their ability, because if you just continually tend to their needs just on a whine or a cry, then the child is conditioning the parent rather than the parent helping to develop child.
Related to that, this is my own question. Why do you think there's been such an uptick in autism in the country?
Oh, I think I'm not exactly sure, but there is a lot more identification, I think, right? So when I was going to school in high school, like looking back, there was a student that was 1 year older than me. And looking back now, like he would have definitely fallen within that autism spectrum disorder, probably under Asperger's. He was very smart, socially inept, but wanted to do everything. He wanted to do drama, but he's just a little bit odd. He wanted to do orchestra and he could do it. He was just a little bit odd. He wanted to do all of these things and he played sports and everything. So he had the desire to be socially accepted. And I came from a very small school. So he was accepted, but everybody knew he was just a little bit different. But at the time, I went to school, I graduated in 1994. I hadn't really heard about autism back then. I really didn't hear about speech therapy even. So I think there's more awareness for one, right? I feel that there is such a spectrum of kids, right? There's children who are on the severe side who are not verbal, they have a lot of behaviors, they're very dependent. And then there is that other side of the spectrum where kids are intelligent, they are excelling academically, they just have a little bit of social ineptness a lot of times. And so a lot of these kids fall under this very large spectrum. And I feel like there's more identification, more awareness. People would say environment is also coming into play, right? So whether it be food or toxins in the air or whatever, there's all these theories about what causes or what could cause autism. But I think one of the reasons why we are recording so many more numbers is one, more awareness, and also another is identification is happening more often.
What can parents do to help their children with language?
Absolutely, good question. I love to incorporate songs. So one of the things I love to do is do nursery rhymes because our language part of the brain is on the left side and our music side, the creative side is on the right side. So when we incorporate the two sides of our brain, we can remember things better. We can you can remember a nursery rhyme that you probably didn't sing as you were a child, but you can remember it now. Or you might hear a song that you heard from high school and you can remember almost all the lyrics, but you probably can't remember a speech you had to present to class in college or high school. Right? So it's incorporating both sides of the brain. And you can also take any nursery rhyme and add your own words to it. So to lay over your own sentences. I do that a lot, even with my son now, and he's 12, but he responds really well to music. So incorporating music to words is a really important, and also really be animated. And I like to add some either hand movements or body movements or dancing to it because by adding the physical component as well, you present things in a multimodal way and you're really leaning on different senses. You're leaning on auditory, visual, and also tactile. So I'll also clap out and tap out syllables for children, especially if it's like a longer word or a longer sentence. Because
For
if you,
those who don't know, explain what tapping out
okay,
means.
yeah, absolutely. So if I don't know if everybody's watching or just listening, but you can literally
Yeah,
take your hand.
this and understand it better, go to YouTube. It's really hard to understand audio only. Okay, go ahead.
Yeah. So so this is a child's hand, I might say like caterpillar, and I'm literally tapping every syllable out on that child's hand, or I can clap it out like be like elephant, and you can see it. They can see the visual syllables. They can also hear it, and then it'll be able to help them articulate better. Because a lot of times kids will blend all of their sounds together, and it will sound like mush, right? They'll be like, ugh, rather than elephant. And overemphasizing each syllable and sound is important.
What are the biggest, back to the book, what are the biggest takeaways from the book?
Yeah, some of the biggest takeaways. One of strategies I love to have parents and educators practice is don't ask a yes no question unless you're ready to honor that no. So if you're asking a child, are you ready to work? Are you ready to clean up? Are you ready to go to bed? Are you ready to brush your teeth? And the child says no, then what are you going to do? You're going to just say, we're going to do it anyway, right? Or so what I do is I offer a lot of choices. So even now I tell my son, hey, it's about time to go to bed. What do you want to do first? Brush your teeth or change into pajamas? Or, hey, we have to cut your nails. Do you want to do it today or tomorrow? Or I might ask a kid, hey, I have a book and a puzzle. And I'll hold it up so they can see about shoulder width apart. I said, which one are we going to do first? So we're going to do these two things, but which one you get to choose. So it lets the child feel empowered by making a choice, and it doesn't make them feel that you are trying to control them in a way.
Why did you write the book in the first place?
I wanted to create a greater impact because I felt like there was such a lack of training for parents, caregivers, early educators, even like new speech therapists and speech therapy assistants. And I'm only one person, but I can duplicate myself by putting the knowledge I have into a book because that's duplicatable, right? So it can be picked up and read by anyone. It's a conversational tool book. It's not a textbook at all. There's very few words that you have to look up, and every word that you might even have to look up is already in a glossary of terms on there. It's like super easy. I think that we can really decrease the number of children who need speech therapy by having more preventative language development strategies out there. So it's like
Uh,
a preventative training kind of thing.
that is awesome. We need those because access to therapy, depending on which state you live in, is very hard to get. Luckily, I live in the best state in the union for Medicaid, so I've had no trouble. But if you live in the worst state in the union for Medicaid, plus have crappy insurance, which I've been very lucky on both, it's not easy to get access to therapy. It's amazing what they make some people go through to get therapy.
Yeah, absolutely.
So what do you want to happen as a result of people, like more people reading the book?
Yeah, I want parents, caregivers, and educators to be able to see behind the veil of speech therapy, right? So a lot of kids, they'll go to speech therapy, but their parents aren't really in the room sometimes, right? Or kids might go to speech therapy at school and they don't get communication from the speech therapist. So I want them to understand that speech therapy is not some magic wand. It's something that can be learned, and you're not expected to know it offhand, right? So if I have a problem with my car, I'm going to take it to a mechanic, or a problem with my toilet, I'm going to call a plumber. So the parents aren't expected to know everything once they have a child. Once they get this training, it should be super easy and understandable and manageable to work and play and interact with their child or children. And I want them to know that it's something that is easy to learn and easy to apply.
So who are the most influential people in your field?
Yeah, I get that question a lot, and I don't really know overall in the whole speech therapy world who is the most influential, but personally to me, the most influential person in my speech therapy career has been my mentor. She was her name is Kathy Mayamori, and she was, when I graduated from grad school, she was my supervisor for my certified first year, and I literally called her almost every day because it was something new. Because when you go to grad school, you're in clinic and you have maybe 4 or 5 kids that you deal with, right? And when you graduate, and I worked in the schools, I had 40 something, 50 kids. And it was just really overwhelming because you're thrown into the school. And I literally called her every day. She was so instrumental in me becoming a competent therapist, me becoming a confident therapist, and working with children and working with parents. Because without her and also a couple other speech therapists on our team as well, it would have been too overwhelming to be successful as a new therapist. And I think I've really been able to take her knowledge and apply it even to today, and would not be the therapist I am today without her.
That is awesome. Do you do any trainings or workshops, and where can people get a hold of those if you do?
Yeah, I'm definitely building some online trainings, hopefully a webinar. It's going to be on my website. Anything that comes up, they can go to playdumbandsabotage.com.
We will have those in the show notes. And just like my own question, what can we do to better help kids with cerebral palsy, especially those who use AAC to integrate those language skills earlier?
Yeah, definitely more education, right? So early on, training those parents and letting them know. I feel like a lot of parents with children with special needs, especially like cerebral palsy, they don't understand that there are devices available or how to access them or what the resources they have locally are. So I think having better education on how to access resources is really important. Getting that early intervention speech therapy, and then also leaning on those specialists that are doing AC, right? There's speech therapists, but not all of them know how to do AC, which is augmentative communication systems,
Which
right?
I honestly think like every speech therapist should know how to do AAC. It should be a requirement, but that's just me.
Yeah, it should, right? But not every therapist is. And some therapists specialize in different populations. But yeah, absolutely more education and overall with speech therapists, with parents. Because I know as a parent of a disabled child, it's like you're very overwhelmed and you don't know where to reach out to.
Where can parents go? I have some idea, but where, because I'm on Medicaid, but where can parents go to get resources?
To get resources. I think it would depend on where you live, right? So in Los Angeles, we have the regional center and they have resources to providers. They are the best resource to help you reach out to different specialized providers. But I believe the best place for any person to go to, any parent, is through your physician first, right? First and foremost, ask your physician. They should be able to refer you to your local organization or connect you with somebody that would be able to help you.
Or if that doesn't work, you can go to a local community service board and whatever your zip code is, and then they should, after you get through the initial intake, which can sometimes be challenging, and you do get an actual support worker, they can direct you to, because those support workers are very talented at that. You're gonna have a few bad support worker apples, but if you find a good support worker, they're very talented. So at that.
Amazing. You're a better resource than me.
I doubt that, but anything else you want to add before we get off here?
Absolutely. I think I would love for parents to know that it's doesn't it's not a reflection of your parenting if you need help. So it's never too early to ask for help. It's never criticism about your parenting if your child is a late talker because you're not a speech therapist and that's not your specialty. It's always okay to ask for help from a professional.
That is awesome. That is some great wisdom that you left us with. Where can people follow you on social media?
Yeah, I'm on Instagram. My professional one is Play Dumb and Sabotage. And I'm also on LinkedIn. I believe it's just Jeaneen Tang, and also on Facebook, Jeaneen Tang.
Okay, we will put all those links in the show notes. And please don't forget to comment, subscribe, hit the bell if you're on YouTube or Spotify. And we will see you guys next episode. Bye. So that was a delightful conversation. I learned a lot from that. Again, we'll have all her links in the show notes. Be sure to like, comment, and subscribe. And we will see you guys next episode. Bye, guys.
Thank you for joining us. We hope you enjoyed the show. Remember to follow the show and our guests on social media and subscribe. Be sure to hit the bell so you'll get notified when we upload new episodes. See you next time.